Bay Area hospitals are bracing for a possible surge on top of a surge due to holiday travel. And joining us now is Dr. Maja Artandi with Stanford Health Care. So good to see you. So let's say if this does happen, do you expect local hospitals to possibly reach their breaking point?
Oh goodness, breaking point. That sounds really scary. I have to say, as healthcare providers, we always work for our patients, no matter what sacrifice it takes. And I'm really proud to be part of the community of the healthcare providers. I have to say, though, that yes, I'm a little bit concerned about the new wave that's certainly coming after the holidays of COVID-19 infections. Let's look at the numbers. In November, the beginning of November, the 7-day average for new COVID-19 cases was about 4,100 per day. Last week, the average caseload for new cases per day was about 40,000, which is quite high, very, very scary. We did see a significant increase of COVID-19 cases after Thanksgiving, and then hospitalizations and death always lag behind new cases. So then about 2 weeks later, we saw the increase in hospitalizations and deaths. Despite the surge and despite the stay-at-home orders, people still traveled for the holidays because they wanted to be with friends and families and they wanted to get away. And we've all seen the pictures of the crowded airports. Unfortunately, this is how COVID-19 spreads. Even before the holidays, California led the nation in hospitalizations of COVID-19 patients. And some counties, especially in Southern California, don't have any ICU capacity anymore. Here in the Bay Area, our ICU capacity is about 10%. So yes, this is really quite scary. The hospitals have prepared for months for the surge, but even with the best preparation, eventually, when the numbers are too high, the resources will run out, and there will be challenges to give every patient an ICU bed who needs it.
Okay, well, a new Stanford medicine study looked at the level of severity of COVID-19 cases and the body's immune response. What did that study find?
So COVID-19 is interesting. There is a range of severity of symptoms. Most people actually, are asymptomatic or just have a minor upper respiratory tract infection. But some people get really sick with severe viral pneumonia, difficulties breathing, multi-organ failure, and death. The authors of the studies wanted to see what role antibodies play in the severity of the disease and if antibodies last for a while. So just a reminder how COVID-19 or the SARS-CoV-2 virus infects the human cell. The SARS-CoV-2 virus has a protein on its surface called the spike protein. And with this protein, it binds to the human cell. As soon as the connection is made, the virus then can enter the cell, infect the cell, and take over the human cell's protein-producing machinery. And it churns out new viruses that then get released in the bloodstream and infect other cells. People who are infected with SARS-CoV-2 mainly make two kinds of antibodies. They make antibodies against the spike protein, and they make antibodies against another protein called the N protein that's on the inside of the virus. Antibodies against the spike protein block the spike protein, so block the connection that the virus can make with the human cell and thus the infection of the human cell. The two vaccines that are currently available both work by making the body produce antibodies against the spike protein. Now, the researchers took several samples from more than 250 patients. Some of them were asymptomatic, some of them had upper respiratory tract infection, some of them were hospitalized, and some of them were even so sick they needed to go to the intensive care unit. And they looked at the antibodies in those patients' serum and nasopharyngeal swabs for viral load. And what they found is that patients who had more severe disease actually had lower number of antibodies against the spike protein and higher number of antibodies against the N protein versus people who had milder disease who had higher number of antibodies against the spike protein. They also looked at the duration of how long those antibodies last, and they found that those antibodies go down quite quickly, especially in patients who only had mild disease, so they didn't make a high number of antibodies to begin with. Now, this study then raises a couple of concerns. Concern number one is, if our antibody response goes down so quickly, are we at high risk for getting a reinfection? The other question is, what about the vaccine? Is the immune response that's triggered by the vaccine longer lasting? Do those antibodies then last longer? Or do we have to think about revaccinating patients on a regular basis?
Well, Dr. Artandi, we know health experts, they initially said we need about 60 to 70% of the population to be protected from the virus to achieve herd immunity. Mm-hmm. But is that enough?
Another question, another way to pose the question about herd immunity is, what percentage of the population needs to be resistant to the virus in order to prevent the virus from spreading? And the resistance can be either due to vaccination or infection. It's really impossible to give an exact number. We only know this number when we reach it and the transmission of the virus is over. But it's good to have a strong estimate because that gives us a goal to work towards too. Now, as you said, in the beginning of the pandemic, experts said 60 to 70% of people should have immunity for the virus to stop spreading. However, recently, the most prominent national expert for COVID-19, Dr. Fauci, gave a much higher number, 80 to even close to 90%. And he is basing this new number on new virus data. There's a new variant out that is much more infective than the old one. And other virus experts agree that now it's more 80 to 90%. What does that mean for us? That means for us that Americans have to almost universally accept the vaccine in order for the country to have herd immunity and for us to go back to a normal life.
Well, 2020 was undoubtedly a very tough one for all of us, and the pandemic, it still shows no signs of slowing down. So from a medical expert and a perspective, do you think that we will be better prepared to deal with all of this for 2021?
I sure would hope so, but I don't know. I mean, the good news is we know much more about the virus now than we know about it a year ago. And we learn new things every single day. Another good news is that we have now 2 vaccines out. They're both highly effective, and worldwide vaccination efforts have started. But the bad news is, and I'm afraid to say that the darkest day of the pandemics are still to come. We are having a surge. We are expecting to have a surge on top of a surge, and we're dealing with COVID-19 fatigue. People are just tired of self-isolating, social distancing, not seeing friends and family. We all crave human interaction, and that's not through Zoom or Facebook. But unfortunately, human interaction, this is how the virus spreads. The other bad news is that even though we have the vaccines, the vaccination of the population is going much, much slower than anticipated because of logistical problems. And some people are still hesitant to get the vaccine. I got it. It's great. No side effects. Didn't even hurt. I highly recommend to get the vaccine when it's available. Now, one thing I'm worried about, though, is now that the vaccine will be available for all of us in the next several months, we might let our guard down. But the vaccine only works once you've gotten it. It does not help when you get COVID-19. So until people have gotten the vaccine, they still need to make sure that they social distance and wear masks. And that's really, really important.
Yeah, it is important. All right, Dr. Maja Artandi, always good to talk to you. Thank you.
Thank you. Happy New Year.